Hey, what up, everybody? What up? Waiting for more people to come on in, so give us a few more minutes. Waiting for people to join us. Whoever's here, thank you. Let us know where you're from. So today we're going to be talking about cardiac arrest. What up, girl? We're going to be talking about cardiac arrest, stroke, as well as some other things, and just to get people to be a little more familiar with what's going on. Again, we noticed in February was actually Heart Month, but this is June, so this is technically Heart Month again, but we're looking more or less for men's health. So that's what we're going to be hitting up on. One thing in particular, I'm going to drop it in the chat for you all. So as you come on in, I'm going to drop this in the chat for you. See if you can go ahead and hit this or answer this real quick. Question says here, if someone claps right in front of you, would you know what to do right now? So if you think about it, let's say you're in the mall or something like that, and somebody claps right in front of you, would you know what to do at this specific moment? What would you do? So anybody, what would you do? So if you think about it, you're walking in the malls or walking in a grocery store, somebody claps right now, what exactly would you do? Me personally, if somebody's walking in, first thing I'm gonna do, scene safe. So make sure the scene is safe, figure out why that person collapsed, and then not just run over there, figure out what exactly is going on first, because why did that person collapse? Was it because he was shot? He or she was shot, or was it because they tripped over something, or was it actual medical emergency? But as you know, everybody will run over there. So I would take my time first to actually assess the scene. So that's one of the biggest things. So anybody else, if you're in the chat, what up, Coy? So what exactly would you do when it comes to that? So all we're doing right now, we're just saying, hey, if something happened, let's say, if you take a look at I put up the, yeah, it says, if someone claps right now in front of you, what would you do? Would you know what to do right now? What up, Walt? What up, Walt? Salute, fam. So anybody else, what would you do right now if somebody claps right in front of you? What up, Irvin? Hey, hey, welcome and thank you for coming. So Dr. Whiteside, Dr. Derek Whiteside, he'll be here later on. He actually have a late admissions. He's doing clinicals today, so he had late admissions coming from the ER. He's got to put him in the floor, so he said he'll show up a little later. You good, Dr. Coy? What up with you?
I'm good. I'm good. What's going on, everybody?
Ain't nothing, just chilling and
Yeah,
relaxing,
yeah.
enjoying the day.
Great
All right, Walt.
Monday. Great
Cool, Walt.
Monday. Great
Yep.
Monday.
Check pulse, see if they're check to see if they're breathing. Check pulse. Yep, that's what's going on. That's
Mm,
one of the biggest things that you should do. Is again, are they breathing? If they're breathing, do they have a pulse? So that's gonna be the two biggest things.
hmm
What do you say, Dr. Coy? What would you do if somebody claps right in front of you right now? What would you do?
Oh man, it kind of resonates. It brings back a situation that I was in when I was a fitness director at a upscale health club,
Mm-hmm.
and it was a gym. It was a two-level gym, and I was on the bottom floor while one of my trainers, was training a client on the upstairs basketball court on the second floor. And one of the things that I really prided ourselves on was emergency procedures and things that would occur if something like this would have happened. We were in a corporate center, you just can't call 911 and expect it to for them to come exactly where you need them to be. So we had to be trained up to know, okay, who to call security, so then security does what they need to do. But make a long story short, one of our clients collapsed, and the my trainer ran down to get me, and collapsed, was still somewhat conscious, but at the same time you can tell that breathing was very shallow, and it was, we were losing him. And so we had the AED. We our procedure was to get the AED right there on hand, to check, call care, go through that situation with our CPR training. So we had to make sure that someone called the EMS and make sure that they gave the right location of where we were. And I actually started to see that he was losing consciousness. His breathing became very shallow to a stop. Did the put the AED on him, got the AED was very informative and let us know exactly what we need to do at the right time and just follow the directions. And we did the most for him. Unfortunately, he passed away. I administered CPR, the AED, all of that. But I think that the most important thing was when we called, I mean, I would say within 5 minutes, the EMS was there and took over. And so obviously it happens, all of that happens in a flash, but you got to make sure that you have someone to call for help while you're there to administer the treatment, to administer whatever care that that person needs. And um but again, unfortunately he passed away, but I can sleep well at night knowing that we did everything that was necessary. And um and so may his soul rest in peace. But I think that it was again, I can tell if we weren't trained up, we didn't know what to do. I can tell how I am. I would probably held that as a uh, I would have been depressed about that. So that's the key.
Yeah, hey, good job, because that's one of the biggest things, and that's what we're going to lead into next. But that's one of the biggest
Yeah,
things is you all actually had a plan, and
had
what
a
I'm
plan.
noticing is a lot of organizations, they really don't have a plan. It's like if this happens, somebody just run to get the AD, but
Hmm.
you have to have a plan out there, especially in the fitness area. You already know. Think
Hmm.
about you're putting your body to a stress anyway, so it's pretty much a
Hmm.
stress test. So
Correct.
medical emergencies will occur. So you already have that prepared, which is what I love, and that's the thing we're trying to promote on the outside as well, is even just for his general family.
Hmm.
If that person goes down, who's going to take care of that person? Who's going to call 911? Just get a game plan together. And I know a lot of people are like, well, why do we have to prepare for this, or we'll prep for this? But you never know.
Hmm.
You rather be prepared than unprepared. That's going to be the biggest things. Not saying you have to walk around with an AED, but at
Right.
least know the basics of CPR. And that's one of the biggest things. But in addition to that, what we're leading into, what we're talking about is heart disease. What do you know about your medical history itself? Do you have any type of heart disease? Any type of high blood pressure, high cholesterol, anything of that nature? Heart attacks. Do we know the warning signs for heart attacks? Do we know the warning signs or the symptoms for stroke? And prevention and action. So that's what we're going to be talking about today when leading to it. So great segue into it.
Yeah.
So when it comes at, let's talk about what do you want to talk about today, Dr. Cole? We got a lot to talk about. So which one you want to hit first?
No, I think the heart disease and heart attack, um, and those things. I think that's very, very important. Of course, it's Men's Health Awareness Month this month. So lots of things that plague us as males. We're the we're not we don't age well. We don't carry these diseases very well, that as our other gender counterpart, right? So it's important for us to bring these things to awareness. Make sure that we have candid conversations about these things, and I hope the panel, even those that may be listening or reaching out to us on this recording, will take time to look at their relative risk, their family members' relative risk, and to not marginalize or minimize these type symptoms, complications, and risk factors.
You got it. You got it. You got it. And I mean, that's one of the biggest things. So what we're going to do is, I didn't get a chance to make my fancy slide this time. So
Oh.
I know I didn't get a chance to make my fancy slide. I'm usually more prepared than that, but school ended. Since school ended, I'm
Hmm.
literally running around, revved up more training that we've been doing. So literally had to train in that too. Then on the road for the kids home, cook dinner and all that. Then
Hmm.
jumped on this. So still no excuse. Still no excuse. But yeah. So one of the biggest things is heart disease itself. And like I say, you face this all the time. I won't say you face it all the time, but that's part of the type 2 diabetes.
Yeah.
So when it comes to heart disease, can you tell us what exactly is heart disease?
Well, heart disease, is a complication of, just disruption in the heart rhythm, chronic inflammation of the cardiovascular system. Is an overburden of the heart function, and this is something that is in my wheelhouse, with dealing with patients, helping patients reverse type 2 diabetes, because type 2 diabetes is a metabolic condition that really does damage to the cardiovascular system. It's a micro and a macro vascular disease. And so one of the complications is it damages the heart vessels, damages the cardiovascular system at large. And so one of the things that we always see, or things that we look at when we look at labs or we look at root causes, we see that complications to one of the big key complications to diabetes is heart attack and stroke risk. And 2 out of 3 diabetics will die of a heart attack. They don't necessarily die of the diabetes; they die of the erosive complications of this disease process. And so when we look at heart disease is mainly I think this is the number one killer in the United States, and the high uh, risk of mortality. And so it's something that we can't mess around with, for sure.
All right. So what I'm gonna do, I'm pull up a screen real quick. I don't know
Mhm.
why I would struggle with this.
Yeah, I
Like,
mean, and again, with heart disease, we're really looking at the heart. It's a muscle. It's
mhm.
it's there to it's a pump. It's there to supply the blood, the the lifeblood of our body throughout the body. And when we look at um, the most common type of heart disease is basically the coronary artery disease, or
Yep.
CAD for
Hmm.
short. And that just basically, that's the blood flow. That's the blood flow from and to the going from the heart and coming back to the heart, to be able to supply us with the oxygen that we need, to supply us with the energy that we need, the nutrients that we need. And so with these conditions, when we see heart disease, these are um, are damage to the vessels, is damage to the structures like the heart and all the areas that it affects. And also, when we see inflammatory processes, these inflammatory processes create problems where we have blood clots, or we have these other symptoms that come around from it. So that's mainly where we see that. And obviously there are different types of heart disease that's out there.
Yep. So if you take a look, everybody, if you take a look at the screen here, like Dr. Corey was saying,
Yeah.
so there are different types of cardiovascular disease. Based
Hmm.
on this is one of the websites I love going to. Is actually focused on cardiovascular. You have your four main types, and like you said before, your coronary artery disease is the biggest things, or your CHAD, but angina pectoris. So
Hmm.
angina pectoris just means chest pain. So that's where
Hmm.
that comes from. Then you have heart attack and heart failure. Now, one thing in particular, I love for people to understand there's a difference between heart attack and cardiac arrest. And even when I'm teaching CPR classes, there's a big difference between the two, because a lot of times they use them same or synonymously or whatever. So I want y'all to know there's actually a difference: heart attack and heart or cardiac arrest. When
Hmm.
you see heart attack, think
Yeah.
about somebody's attacking you. They attack you right then. That is considered a heart attack. That problem is occurring right then. Cardiac arrest is going to be different. Cardiac does mean heart. However, arrest, just like if somebody say you're under arrest, you have to be stationary. So cardiac arrest just means that the heart is not pumping at all. That's
Right.
going to be the biggest things between a heart attack and cardiac arrest. Cardiac arrest, that heart stop beating altogether. You have to initiate CPR. Where heart attack itself means that there's damage in the different areas of the heart. So we want to make sure you understand the difference between those two. And again, you have the angina pectoris. That just means chest pain. And you're going to, I won't say you in general, but people will tend to have chest pains, and chest pains vary from person to person. Again, from person to person as well. Stop, boy. From person to person as well as from male and female. So it's going to be totally different. Females may have a different type of chest pain compared to males. So we want to make sure we understand that part. Ducko, you want to add anything? What up, right? White Rambo. What up? What up? What
Mhm.
up? Thank you for coming.
Yeah. So, it's interesting that, we looking at this slide here in the four uh, cardiovascular disease types here, the common ones, the coronary artery disease or the coronary heart disease. That's going to be that's going to be damage, to obviously the blood flow, to the heart and from the heart. And these symptoms that you see, the angina, that chest pain, the heart attack, that's another symptom of coronary artery disease. And then obviously heart failure. It could be congestive heart failure. That's basically just the heart just failing, at that pump is failing. The second one is a cerebral vascular disease, the CVD. This is another complication. If you just look at the cardiovascular system at large, it's basically the highway. It's a massive highway system, and I forgot how many miles of blood vessels that a body has, and just imagine there's a lot. Um, and so, the blood vessels have to supply resources to every point of our body, every function of our body. And obviously with stroke, that's basically the brain is not getting its proper supply and resources. And so that stroke is just, occlusion or a blockage of that vessel going to a part of that brain. And if it goes for a certain amount of time, that tissue dies. That tissue in the brain needs that blood supply, needs that oxygen. And obviously we see the TIAs are transient ischemic attacks. These attacks come intermittently. They're very mild in nature. And I don't even like using that word, that is a mild heart attack, like, or a mild stroke. um, no stroke, no heart attack is mild. Whenever you have, a decreased flow to that area, and that's where that transient ischemic means it's a narrowing of that blood flow. So much like, you're going down a 6-lane highway, and the 6 lanes turns into just 1 lane, right? So there's going to be a blockage there. And so that's where we have these issues where the tissues are not getting, the cells are not getting the proper oxygen, what they need to function properly. And so these are smaller attacks that can be very damaging. Sometimes they can go asymptomatic. Sometimes they will give you a symptom. So it's very interesting about that.
So if you take a look at the screen, like Dr. Corey was saying, these are your three main types. You
Mm.
have your ischemic stroke, and just like it says in here, the most common type of stroke occurs when a blood clot or plaque blocks the blood vessels, reducing blood flow to the brain. So you
Mhm.
think about it, that's just like us. If there's a reduction in oxygen to our lungs, we're struggling breathing. So in this case, there's a reduction of blood flow going to the brain. So again, that's going to cause your drowsiness or being off centered, off balance, things of that nature. So that's where that comes into play. Your second one is your hemorrhagic stroke. And this one, just like in the picture right here, if you notice, there's a rupture in that blood vessel. I tell people when it comes to the rupture in the blood vessel, it's like I tell people, if you think about when we were younger, we had that basketball. Hey Wanda, if we had that basketball, or we were riding that bike, and then there was a little nipple on the bike, or there was a big bump on the bike on the tire itself, and that was a weak spot. And if you pop that, air will come gushing out. That's the same thing when it comes to hemorrhagic. There's a weak area in that vessel, and there's just so much pressure there that the vessel's like, I can't handle it anymore, and it just pushed through and it ruptured. And then your last one is your TIA, or like Dr. Cole was saying, your transient ischemic attack. It means what we call a mini stroke, that it occurred. There was a blockage there somehow. It occurred. It occurred, and then after a while, it was released, and the blood flow was able to go back through. So those are your three main types, and it's very important because a lot of times, if you suffer from some type of cardiovascular disease, more than likely you're dealing with high blood pressure, type 2 diabetes, or some type of diabetes. But in addition to that, you could have the high cholesterol. All these could be unknown, means you didn't know anything about it. So getting a physical is very important when it comes to that. Dr. Cole,
Yeah.
you want to add anything?
Yeah. I was talking about that one gentleman that unfortunately passed away. Um, you know, we had to administer, he basically collapsed on the basketball court. We went up, applied CPR, AED, and we did the best we could, but he ended up passing away. So come full circle, we come to find out that he actually had a aortic aneurysm, and aortic aneurysm is basically, the one of the big blood vessels that comes off of the heart actually had ballooned, and that's the aneurysm, and it burst. So think about that. You look at your hose, your a garden hose, and for some reason it just starts to balloon up. It's some damage to it, and it just balloons up, balloons up, balloons up, and then all of a sudden it just bursts. That's the same thing that happened to that gentleman. And unfortunately, there was nothing that we could have done to help him survive. But one of the things that we have to go back and backtrack is that, there were symptoms that were occurring with him. And if you ask, well, you go back in the health history and start asking certain questions, there was signs of fatigue. There were signs of brain fog. There were signs, again, low energy, lethargy. And this was a very driven individual, and personality changes and things of that nature. So there were things that are occurring prior to that aneurysm. And so much like an aortic aneurysm, just think about, a stroke is basically that blood vessel bursting in the, or the hemorrhage is a bursting of that in the brain. But this is a key thing here. The aorta is a massive, massive blood vessel, and basically is going to supply the blood, from the heart down to the lower extremities, and that's a big highway of blood going down there. And so when that aortic aneurysm occurred, it just basically burst. And even sometimes you can even see this on an X-ray. Um, being a doctor of chiropractic, that's one of the things that we had to really study in school, because you can even see this. Really, you can see this on an X-ray with an aortic aneurysm. When you look at an X-ray, the profile view of an X-ray, and you can see that you see how this balloons, or you see how that it kind of just has this fat, um, um, rounded, uh, presentation. And you can actually see that on an X-ray, where you're not supposed to see a blood vessel on an X-ray, but the fact is the body's trying to create some stability with that ballooning, it will calcify, and you can see that hard tissue show up on an X-ray. And that's something that you got to really be careful of with, doing chiropractic adjustments or any other blunt force, things of that nature. So um, and another thing, let me just give another story about that is there was another gentleman that came into my office, low back pain, had a car accident, and we did the workup, and his blood pressure was through the roof. And we're thinking that, oh, well, he just got into a car accident, he's very stressed. But his blood pressure was abnormally high. Like it was crazy high. We look at the x-ray, and lo and behold, I measured his you can see that there's an aneurysm, of his abdominal aorta. That's the big blood vessel going down to the lower extremities. And I couldn't treat him. I literally drove him to the hospital myself, and he was admitted to the hospital. And I would say I actually supplied the x-rays and measured it to the T, and he was able to get the care that he needed, and he was able to get on medication. And as he came back to my office, once he got cleared, you can see an improvement in that aneurysm. So I would say that my training, kicked in, and I would say that I probably helped save his life. And if it wasn't probably for that accident, for him to
Mm-hmm.
get the x-ray that he needed, he probably would never known. He would have thought that it's just high blood pressure, and he tried all these medications and things of that nature, but it was a walking time bomb. So again, coming back to what you're saying is sometimes these things can be asymptomatic, and they can not elicit a symptom or whatever, but you got to make sure that we get checked out, especially as us fellas. We have to be better at getting to the doctor or getting some checkup and physical and things of that nature.
No, I agree with you 100% on that. What I want to do, I'm pull up a picture real quick.
Mm-hmm.
And this shows like how for us, because again, I'm a visual person. So if you take a look, this is your aorta arch right here.
Mm-hmm.
And everybody know I'm a school teacher, sorry. So I'm gonna teach real quick. So this is your aorta arch, and you have your three parts coming out. So what's happening is in this left ventricle, because our left ventricle is a lot thicker, and it's pushing against pressure to the rest of the body. So you have your three arches here or your three vessels here, but then you have your descending as well. And that's what we're referring to. There's a lot of pressure there, a lot of high pressure there. And from that previous picture is if anything in that area weakens and that ruptures, is nearly impossible to save that person's life,
Mm-hmm.
especially on the outside. On the inside, doctors catch it real quick, they can stitch it up. But on the outside, we've had calls for that as well, where they say a possible AAA, abdominal aortic aneurysm. And it's like, oh crap, we got to do this real quick. And we rush them to the hospital. But at the same time, if it ruptures with us, there's nothing we can truly do about that, because again, that's a large vessel. And if it ruptures, you bleed out. I tell people, think about it like this. If you're heavy into a community, think about if you had a gunshot to your thigh and it hits that femoral artery. That femoral artery is under a lot of pressure, so you're going to bleed out instantly. So you have to try to stop it. When it comes to the aorta, it's the large vessel as well. It's actually bigger than the femoral artery. And if it ruptures, there's no tourniquet, no Israeli bandage, no nothing. That is only by surgery you can actually do that. So, Dr. Corey, you did save his life when it comes to
Mm-hmm.
that part. You truly did, because you call 911, like say it takes anywhere from 5 to 7 to 10 minutes to get there. Then we got to walk up the steps and all that. He could have died by then. But for you to recognize that and take him to the ER, that's what we leave. So
Mm-hmm.
excellent job on that. That's a true healthcare provider there. So thank you for that. Now, for this, what Dr. Corey was talking about before is the causes of it. So if you take a look, you may not be able to see it, but there's some causes for aneurysms or causes for high blood pressure, diabetes, and all that. For cardiovascular diseases, high blood pressure is one. We
Mm-hmm.
must have our blood pressure monitored. If you have a family history of high blood pressure, you want to get that checked as well. And I'll pull up a slide later on about the different levels of blood pressure. Smoking as well weakens the arterial wall, so you want to be careful of that. Hardening of the arteries, changes in the aorta due to advanced age. So the older we get, the weaker those vessels get. Longer with our veins, so the longer with our veins, but the weaker those vessels gets. So got to be careful of that as well. You talk about this all the time. Inflammation. So inflammation in the aorta. You're gonna have inflammation in your bones, joints, and everything else. So inflammation in the aorta. Untreated infections such as
Mm.
syphilis or salmonella, and even just genetic diseases. So these are different causes that can lead up to your cardiovascular diseases or your strokes and things of that nature. So you want to be mindful of that. Dr. Corey, you want to add anything?
Yeah, I mean, these are great examples of things to watch out for. Again, me being a functional medicine practitioner and looking at the patient and how they present themselves. Usually they're reaching out to me to help them reverse type 2 diabetes. A lot of them don't even know that they are at risk of having a heart attack. And that's another unfortunate aspect of my job, is that sometimes I get to really be on the forefront of helping someone to get well, and then sometimes it goes the opposite way, where sometimes patients will minimize, or well, they don't even become patients at that time. Is that with my practice, I really handpick my patients on folks that are really serious about reversing their condition, and I'm very selective. And there was even one gentleman that really minimized his symptoms, and and then end up finding out later that he had a heart attack. There, a couple of weeks after I consulted with him. And so these are things that you got to see. You see the blood pressure, you see the diabetes, you see, that there are headaches, and that's another symptom that's oftentimes gets missed. Is that and that's another reason why that going back with the health history of the gentleman that passed away after we tried to administer CPR. You know, he was complaining of headaches, just headache. He couldn't get rid of the headache. It took all kinds of medications, things of that nature. And so these are things that can occur there. And obviously, it's not going to be always textbook symptoms and things like that. It's not going to be exactly how you'll see it. It's just there to give a guideline, things to watch out for and look for. But you have to recognize some of these things that occur. So um, have to watch ourselves.
So in the chat, so those in the chat, I want to know what are some signs and symptoms of a heart attack. So how do you know if somebody like you or even your family member, what would you know, or how would I say this? What are signs and symptoms? How would you know somebody's having a heart attack or suffer from a heart attack? So if you can just put that in the chat real quick, how do you know, or what do you think some is, or some of the signs are, or even symptoms are of a heart attack? Would it be falling down, getting dizzy, lightheadedness, dizziness? What are some signs and symptoms of a heart attack? The reason I'm asking this is because it's summertime
Mm.
and we're all out. We're cooking out. We're eating fried food. Every Friday is fish, fried fish Friday or something of that nature. So while you're cooking out, and the 4th of July is coming up as well. So we want to know. We want you to be on your P's and Q's when it comes to this. Are you able to identify those signs and symptoms? So what are some signs and symptoms of a heart attack? I thank you, Urban. Chest pain. I take that. Chest pain is one of them. Anybody else? What else do we have? So we do have your typical chest pain. And again, understand males and females chest pains may be a little different, where
Mm.
males may have midterm chest pains, but females may actually have pain between their shoulder blades. So you have to be mindful of that. But chest pains is truly one of them. So excellent job on that one.
Hmm.
Frozen face. I like that. Again, that can mean several things. When we say frozen face, like deer in the headlight kind of stare, is they see death coming upon them and they don't know what to do. So frozen face is one of them. Okay, cool. Take that. Anybody else? What are other signs and symptoms? Irvin, you on
Hmm.
a roll today. I ain't playing with this one. All right. So we have tingling in the arms. I take tingling in the arms. I got you, Walt. Shortness of breath. Again, Back in my day, we said SOB, but we know what that meant as well. So we don't say SOB no more. We just say shortness of breath when it comes to that. Okay, shortness of breath. Anybody else? What else y'all got? Think about the movies you watch as well when you're watching these different movies. Like Tyler Perry just released his movie as well. So think about these different ones. What are some other signs and symptoms you all are actually hitting? And I love this because you're able to identify these. So I really truly appreciate participating because yes, those are some of the signs and symptoms of it. Anybody else? What else do we have? I'm about to pull up a picture now. All right, so if we take a look here, so we have the chest discomfort or chest pain. We have the shortness of breath. So excellent job on that. I got you, Val. Weakness, loss of mobility. Good job. Yep. So we have upper back pain, chest discomfort, indigestion, anxiety, irregular heartbeat. Because again, when we say irregular heartbeat, our normal, and I'm not going to get too medical, but typical heart rate or typical heartbeat is what we call normal sinus rhythm. But then you could go into a VTAC, what we call ventricular tachycardia or ventricular fibrillation, where that ventricle, that left ventricle, is just quivering like this or just beating too fast. So you may have those two. So you have to be mindful of that. Dizziness, fainting, fatigue, nausea, vomiting, cold sweat. Those are all excellent ones. Yes. So we
Absolutely.
have loss of balance as well. Yep, because again, your body just gives out, especially if you're going to a heart attack and go into cardiac arrest. So your body will give out. So that is true. Hey, look, everybody sees Dr. Whiteside. As you tell, he's making look out, he's making his rounds right now. So he's actually at the hospital working, making his rounds. So yes, those are 10 of the common ones as I scroll down and it breaks it down. One thing in particular is let me remove this real quick is anxiety. So anxiety, feeling extreme anxiety or a sense of impending doom. That one in particular is very interesting because I've had a patient where we got a 911 call and the guy literally looked me in my face straight to the point and say, I think I'm about to die. That's one of those ish or your sphincter muscle pucker real quick. It's like, dude, if you think you're about to die, you're more likely going to die with a straight face like that. So yes, so impending, your impending doom or something of that nature along with it. Again, heartburn or indigestions. Yep. Here you go, Walt. Walt say they say this is the big one, Elizabeth. I'm coming to see.
Golly.
Anybody remember what show that is? I
Oh
remember
man.
Sanford and Son.
It's Sanford and
Sanford and
Son,
Son.
man.
Yep. Look, we're
Oh
showing our
man, we
age
dating
now.
ourselves, man. Yeah, I mean, one thing that we have to recognize, and the way I kind of simplify this is that your heart controls all of your blood vessels and controls that blood flow going throughout the body. And so, if there is some type of issue or an attack, basically you can look at all the organ systems and everything that's going on with you. You can scan the body from the top of your head all the way down to your toes and pinpoint how that can affect how that attack or that problem with circulation can affect it. So I mean, one of the things that's good about this question is that many of you are answering and you're spot on. And you can just basically almost like you're stepping into a scanner from the tip of your head down to your toes, and you can say, okay, what's gonna happen? What kind of symptoms, what kind of things can happen in the head as a result of the heart attack? And you can name some of those things, and then you just go down to your chest and back, upper back. You can go down to even your stomach. Like one thing that's missed, that I missed, is indigestion. Like when you're having, sometimes you think it is an issue with you just eating bad food, or you having acid reflux or a heartburn. Meanwhile, you're really having a heart attack, you know and largely, these things, can mimic other type symptoms. And then obviously going down, to even one of the things I talk about in my webinars and in my classes, with type 2 diabetes, is sexual function. Like that's a big one too. Like you'll see patients that are dealing with, these heart disease things, and they're trying to perform, and they can't sustain an erection, and they go reaching for the blue pill just to be able to perform, and that's a problem. And one of the things that I tell patients and potential patients is that because you have that low libido, or you have issues with sexual function and everything of that nature, and I see the comment low blood flow, but that's not just it. That's a direct correlation to there's a direct correlation with ED and heart attack. And that's not just because we're getting older and we can't perform and all these things. And this is some things as men, we don't like to always talk about, but I put it out there because that is, if it's something is going to cause me to die, or it's going to have you have that direct correlation, that's something that you got to know. You got to talk about that, because that's something that's going to be dismissed and minimized, marginalized, and it ends up costing someone's life. And lo and behold, oh yeah, this person had diabetes for years and years and years. Well, that's just eroding the blood vessels. That's eroding the systems of the body. Or this is not a hormonal issue. Well, this is ours because the body's just deteriorating. And there are numerous studies that show that when you're not able to perform, you have that low libido, that's a sign that the body's potentially could have a heart attack. And obviously there's been cases where folks have, have met the mountaintop, and they were able to have that erection due to some medication or whatever, and it was too taxing on the body. It was a stress test, and they end up passing away while having sex. So that's something that you got to really look at as you scan the whole entire body. um, you can pretty much pinpoint symptoms and problems and issues that can come about from cardiovascular disease.
One thing, so which made me giggle a little because, like you say, you take the medications, and reminds me of a 911 call we had where
Oh boy.
literally that's what exactly happened. It was in a well affluent area. We got out there. It took us about 12 minutes to get out there because I remember to this day it was just the 911 call came in Sunday morning about 9 in the morning. Came in about patient down unknown. We get there, the wife answers the door in a bathrobe. We're like, okay, that's kind of strange. Why is she in a bathrobe answering the door? And we're like, Joe, what's going on? I didn't say, yo, what's going on? I'm like, so what's going on? Can you tell us what's happening? She like, he's in here. We get in there. He's in a bedroom, butt naked, or what they call bucket naked. He had a massive heart attack and coded right there because, again, it was so much pressure. People need to understand because that blood is being pulled from other areas and going straight into the penis that the body can't handle it. It did a blood dump and then passed out, went in cardiac arrest. He literally died right there.
Hmm.
So got his last one in before he died, but
Oh
say that,
Lord.
but he died right there.
God.
So hey, he went out happy, I guess. But yeah, that's one of the that's one of the biggest things. So you have to be careful with this medications. Not even with just that. I tell
Right.
people it's just what is it? Medication from the convenience stores as well. Whatever
Mm,
that I forgot what it's called. Joe I know what
yeah.
it's called. But yeah, that whatever it's called, I forgot what it's called. But them little pills not him, but people will pop right before they get up with that sneaky link. So something like that. So
Ah,
I'm just being real. So something like that you just got to be careful with because look, y'all don't want to see my face coming in. I'm like, oh yeah, honey packs. That's what it is. Thank you, Joe. I should I let you know I don't know nothing about it. So honey packs. So
all
not saying
right.
you do,
All
but
right, Joe. Joe, you been using those honey packs? Golly. Y'all been using them
what
honey
up, Chew
packs?
Mama? So yeah, so that yeah, so you got to be careful about that. And one thing in particular is, like Dr. Coy was saying earlier, is blood pressure.
Yeah.
When doing this, you got to be mindful of your blood pressure, and doctors will monitor this as well prior to prescribing these different types of medications. But at the same time, you can go to these different websites and order you some good pills. I hate to say it like that. You can order you some of those pills as well, so and not realize you actually have a you actually Sorry, Joe, I made me laugh.
But here's the thing, though. This is an issue. Like, I think this is an issue. Sorry to get on a tangent here, but like when I see patients, a lot of times they're thinking that they have hormonal issues, and then they
Mhm.
go leap for these testosterone pills or
Yeah.
testosterone boosting supplements and all that stuff, and they're literally on the verge of having a heart attack.
Hmm.
They're walking around like a walking time bomb, and they're just like so concerned about not being able to sustain an erection. And and then I pulled the labs up. One of the chief markers, there are two actually, two markers that I always run, and it's CRP, high sensitive C-reactive protein, and another one is homocysteine.
Hmm.
Those are markers that are in blood work that oftentimes, sometimes even cardiologists don't run.
Yeah,
That's hard to believe.
that's crazy, but yeah, I
That's
believe.
It's hard to believe, and that tells you your relative risk of having
Hmm.
a heart attack. And so when a person is coming in and saying, "Yeah, I got high blood pressure," and they're on medications, they're on the amlodipine, carvedilol, they're on the losartan, and all these blood pressure medications to basically put lipstick on a pig to
Yep.
try to bring the blood pressure down. And then lo and behold, I would run their labs, and those labs will say, I mean, it's almost like I'm revealing something that's something brand new, and it is. It's they never had these things ran before, and what that does for me is just validates the fact that they're not well, and they're walking time bomb. And so yeah, those are labs that you can ask for, but it's up to your doctor to run it. And it shouldn't be things that you should be asking for, but no need for me to bark up that tree.
So
uh,
yeah, well,
I know what I
as
do.
for it,
I know
yeah.
what I do. And
Hmm.
so I'm always looking at, okay, what's the worst case scenario with this situation? Because I know that the risk of heart attack and stroke risk is high.
Hmm.
When you're seeing brain fog and all these things that occur, these are signs of Alzheimer's disease, or a potential risk of stroke with that
Right.
individual. So
Yep.
these are things that they should be routine, but oftentimes they're not.
Yep. And talking about stroke, and as we talked about earlier, is your blood
Yep.
pressure. So looking at this diagram,
Yep.
here it just says your five main blood pressure ranges.
Hmm.
So, but we wanted to make sure, do you know what blood pressure is? And then here it says a blood pressure test measures how hard the blood is pushing against the walls of your arteries at two key moments:
Right.
when the heart contracts and when the
Hmm.
heart relax. So that lub and that dub. So the top number we'll call the systolic number, which everybody know in textbook is 120. And from this diagram here, you'll see that as well. That top number is when that heart is contracting.
Hmm.
So when the heart is contracting, that number should be higher. When that heart relax, or the dub part of it, when the heart relaxes, your bottom number, that should be lower, because now your body is more relaxed. And when your body is relaxed, it should flow through with no problem. But if that bottom number is higher or is high, then there's a problem. That means there's a higher pressure even when your body is relaxed. So that does bring a concern. Again, over here looking at it is normal blood pressure. So we go from the bottom up. So the bottom 120 over 80 is textbook. Again, I tell people it can be a little lower, it can be a little higher, but textbook is 120 over 80. I had one patient say, well, my blood pressure is 122 over 78. Same thing. So you don't have to stress that. Is when you get up to the 130s to 139 that, hey, you want to pay attention. What exactly is going on? Do you have a family history of high blood pressure? And if you do, make sure you get tested more often. Take a look at the food that you're actually eating as well.
Hmm.
Now, if you go up to the red area, and that's red for a reason, means stop, is that 140 plus or 90 plus means that's a lot of pressure on that vessel now. That's when you start having headaches or visual disturbances, things of that nature. You may have it at the 130s, but again, at the 140s, you're definitely going to have it. I tell people the easiest way to remember this is if you've ever been on caffeine for so long, and you stop cold turkey, you get those bad headaches. It will feel like that when that blood pressure is high because that pressure is pushing on those vessels and it's causing that pain, or you have visual disturbances, or you're seeing spots in your vision. That's where that pressure is coming. And then now at the very top, 180 over 120, you're about to blow a vessel and you're about to die. I won't say die, you're about to have a stroke or something of that nature. So you want to be careful of that. Again, like you say, the medication may help, may not help others, but even if you're taking that medication, what does your diet look like? Are you exercising? Those are the things
Lifestyle.
that you have to, yep, your lifestyle. So those things you have to actually factor in. The medication could be a temporary fix, but the lifestyle modification should be your permanent fix. You got to fix all of that as well. Understanding that some people, yes, some people have a family history of this, so you can't fight genetics. We totally understand that. But at the same time, some people are just pushing it to the limit, going out
Yeah.
there drinking the beer, slamming those Red Bulls or those Monster Energy drinks, then doing smoking, eating fried food, and all of that. So again, the lifestyle change, like Dr. Coy said, and like what Jova said, lifestyle changes what you want to actually take account of. Make those changes. So excellent job when it comes to that. Any questions before we move on for the chat? Any questions about blood pressure? Because we got Dr. Coy and Dr. Derek Whiteside on. Any question about blood pressure before we move on to the next thing?
Yeah, I know that Walt was asking about those labs again, and
Yeah.
those markers for risk of heart attack and stroke. It's one of them is called high sensitivity C reactive protein, or CRP for short. High sensitivity C reactive protein, and the other one is homocysteine. Homocysteine. These are markers that are very, very important to run to see your relative risk. And there are even other markers that I run on patients, in regard to just looking even deeper at cholesterol. Cholesterol is not the basic cholesterol readings are not enough to really take a deep dive, but you have to really look at and scrutinize those markers a little bit harder. So, but those two are the main ones they're really easy to run, and yeah, so that's what that is.
So Joe Val say, what are some natural remedies to lower blood pressure? Because remember we talked about it earlier. We talked about how salt and your different types of salts that you make. But what are some natural remedies? Because not everybody want to take the medication, like you say, putting lipstick on a pig. So what are
Mhm.
some natural remedies you could do to help lower blood pressure?
Well, I mean, I think that um, I'll take it a step further. I think it's important to understand that the same way you can look at medication to address blood pressure is the same way some natural holistic professionals, they like to use herbs and um, supplements the same way. And if you're not really addressing the root of it, I think that's a bigger issue. I think that's where you need to really look at, not just looking at, okay, well, let me take this and that's going to help my blood pressure. You can you you got to remember, these medications are basically trying to mimic natural things, or natural things in our environment. To It's a synthetic version of that. And so, one of the things with blood pressure, though, blood pressure is just a sign, it's a symptom, it's a deeper issue that goes on with that. So you got to understand that if there's a massive amount of pressure going on in the cardiovascular system, you got to know what's actually driving that pressure.
Mm-hmm.
And that's my scope on it, is that there are numerous drivers of the blood pressure. So you got to really look at it from that vantage point. And I think that's where you have to go in and get in a thorough exam to understand that a lot of these things are driven by inflammatory processes. It's a flame. It's a flame going on within the body. And rather than just, sprinkling a little water on it just to get it down, extinguish it. You got to get to the root of it. You got to really understand what's driving the whole issue in the first place. And so, of course, yeah. I mean, you can Google that yourself and say, blood pressure, natural remedies for blood pressure. But I wouldn't want you to fall victim in thinking that that's an easy fix, because it's not. It's very temporary, and it still leaves you susceptible to numerous things, because you can still, you know, pad or cook the books, so to speak, with the numbers, but you're not really addressing the real issue that's driving it.
So what about this? Can
Yeah,
you reverse high blood pressure and come off of medication? And
absolutely.
I know it varies from person to person, but yeah, explain that.
Absolutely. So again, when you're looking at, well, let me just say this. The opportunity is afforded to anyone that really is willing to do what it takes to do that. Is it a guarantee? Absolutely no. Nothing is guaranteed, right? But if you're really have a root cause focus, absolutely that you can reverse it, and you link up with the right practitioner to do that. So so Joval, you were mentioning weight loss and diet change and exercise, and those are good components. Those are components that, to be honest, any and everybody should do, regardless of whether you have high blood pressure. These are lifestyle factors that just affords you the ability to have, or the potential to have, a good life. But when you're seeing there are other factors. They could be, we talked about a little bit of these symptoms. There could be underlying infections that's going on that don't give us, don't give you an immediate reaction. There are numerous toxicity levels that could be driving that, and that's your way of knowing that is because you have high blood pressure. That is a deeper issue going on underneath the surface. um, their blood sugar issues. Of course, yes, you got to address your nutrition and your diet. You got to make sure you're drinking water. You got to make sure that you're looking at your stress levels. Stress levels are another key component of it. Cortisol and all these other hormones that help you to sustain life. And so, adrenal function. You got to also look at your kidney function. You got to look at your liver function. You got to look at all these factors that come along with that. That the blood pressure sometimes is just the symptom that lets you know that something deeper is happening. Don't look at it from blood pressure is high and that's it. And okay, I see this doctor for this. I see this doctor for this. I see this doctor for this. A lot of it is just intertwined, and it's just trying to let you know that, hey, there's a deeper issue going on underneath the surface. And so that's my perspective.
Dr. Whiteside, since you settled down, I got you on mute. So you want to add anything about that? Welcome, Dr. Whiteside. Look all fancy in your white.
Sorry,
Wow.
man. I was dictating. What you got? I wasn't. I ain't even hear it.
No, we're talking about can you reverse? So pulling back up, can you reverse high blood pressure come off of medication?
Yes, I actually had one patient do it. It comes down to diet and exercise, and it's not the we eat um, bunny food, but literally just watch your carb intake, watch your intake, and you're looking at your weight. Just lose the weight, because the increased adipose tissue is what's causing the issue, which is going to cause elevation in the blood pressure. The other thing you want to look at is what is your salt intake. If you're taking in a lot of salt, of course, fluid follows salt, so your pressure goes up. The goal is to decrease your salt intake. Your salt intake goes down, your pressure goes down as well. Some people are just predisposed to elevated blood pressure because of genetics. But so there's no way around to changing genetics, but you can control your blood pressure by actually being active, being out there and exercising. That's really, to me, the main way of controlling your blood pressure. Other than if people want to come in and see me and I'll put them on medication.
I so yeah. So to prevent seeing him for high blood pressure and take the holistic approach, so get your testing done. That's gonna be one of the biggest things. But yeah, I do understand that. So Urban talking about how do you know you're hydrated? Is there a test to make sure you're getting enough on a cellular level? Either
Yeah,
way.
there is. It depends on the most basic way I tell people is if as long as your urine is clear, you're staying hydrated. Anytime your urine turns a yellow or any type of color, that means you're not staying hydrated. That would be the first thing. The other thing is at any point when you start saying, "Oh, I'm a little thirsty," that means you're already dehydrated. You should never actually have that feeling of, "Oh, I need to drink some water," because you're already behind the curve. What you got, Corey?
No, I mean, I agree with that. And you can also see it on labs too, where a person is dehydrated, with certain markers. And that's a thing there too, is that oftentimes, what I see is when patients have a dysregulation with their glucose levels, or they have dysregulation with inflammation and all these things, they and they tell me they are drinking water. They're drinking lots and lots of water. But if the cells are not communicating properly, they're having all these different imbalances and disruptions. They're not accepting that water. They're not hydrating properly. So you just putting the water in and then you're peeing it right out. And so that's important to know too, is that there are numerous reasons why the body says, you know what, I'm not going to absorb that water properly. So if a person is drinking a lot of water and yet they're still dehydrated, that's a deeper issue that needs to be investigated as well.
Cool. Go with that. Dr. Weiss, how you good? Good man. I'm thirsty. I need to get something to drink. But anyway, so I was
You dehydrated.
yeah, I'm always dehydrated, but that's not surprising. After taking in 2 gallons a day and then going to just a gallon a day, yeah, I'm hydrated. I'm dehydrated. Yep, not surprised. I was just laughing, talking about big back.
Big back, big back.
Oh my goodness. All right. So moving on. One question. So excellent questions when it comes to high blood pressure. I love that we actually hit that when it came to that. Question for you all in the chat. We talked about high blood pressure. What about strokes? That's what I want to know. How do you know if somebody's having a stroke? Make sure I put that up there. So here, Carver say, let me get on the treadmill. Carver say, let me get on the treadmill right now. All right, so how do you know when somebody's having a stroke? That's our biggest things because some you may think they're having a heart attack, but they may actually having a stroke. So for you all in the chat, how do you know if somebody's actually having a stroke? Urban ain't playing today. Slurred speech. I love it. Okay, we have left side paralysis, or in this case, paralysis in general. Okay, facial paralysis. Okay, cool. We got that. Anybody else? I love these. Y'all hitting it, making it easy for us. So, what are some other things? So, from you all in chat, y'all keep typing in because I love this. Facial droop and loss of motor functions. So, Dr. Whiteside and Dr. Coy, what else do you have for that? What up,
Ma-
G23?
massive headache, um, vision issues, and just a headache, oftentimes that they'll sometimes describe as the worst headache of their life. um that they can't get rid of it, is a constant type of pain. But obviously with vision, and sometimes even they'll have some issues with taste or smell. They have taste or smell issues, poor hearing. So again, when you're thinking about the head and looking at all the systems and all of the senses that come about with that, you can see how that can affect all those things from speech. Love that one. The muscles, the motor. You're looking at sensory, how you're feeling, tasting, smelling, hearing, vision, but you're also looking at your motor, how you're able to make faces or lack thereof to make faces. Blink your eyes, move your tongue, move your mouth, and all those things. So that's really what you really want to look at when there's a issue with any of those functions, whether it's sensory or motor. Oh, I think you're muted.
I have nothing. I
There we go.
agree.
So it's what we call here fast or be fast. And that's what you all hit before too. One of the biggest things for us when we get a 911 call to make sure we had to differentiate between somebody that's having a diabetic emergency or somebody's having a stroke because they mimic the same thing a lot of similar signs and symptoms. So balance, and Jovi talked about that as well. A loss of sudden balance, left side, right side. So you have a loss of balance, visual disturbances. But the fast is what we're looking for, the FAST. And that's another thing we'll call 911 as soon as possible. So face. So you're taking a look at the face. Is there a facial droop? And that's what we want to see because one side will have a drooping effect compared to the other side. The arm is one arm hanging down. And what we do is we check the grips. We tell, hey, stick out both hands, stick out your arms, grab my fingers, squeeze my fingers with both hands. Squeeze as hard as you can as you want to break them. Then from there, we're able to figure out if there's left side of weakness or right side of weakness. Their speech. Are they having a slurred speech where that person may think they're talking normal, but you hear the slurred speech? And also T for time. Time is of the essence. You must call 911 as soon as possible. And we do this because there's a stroke protocol and we don't want to miss that time frame when it comes to that. So yes. So again, be fast. So in this case, we talk about fast. Always remember that. Facial droop, arm swing or arm movement, speech is a slurred speech, and also call 911. At the same time, if they're diabetic, if you have a glucometer in there, check their sugar because when we get on scene, that's going to be one of the first things we do. We're going to check their sugar to make sure they're not having a diabetic emergency, but call 911 as soon as possible. And I tell people, you may be at a cookout, you may see this, or you may be at the mall, or you may be at a grocery store. Somebody may have one of these cardiac emergencies. As us, as medical professionals, we want to put this out there to say, hey, these are signs and symptoms. So just in case you run upon this or a family member has this. So that's where this comes to play. Any of y'all want to add on to a stroke, signs and symptoms of a stroke?
I think you hit the nail on the head with that one.
Yeah, you got everything.
No. I can do it right sometimes. So when it comes to a stroke, like we said before, is the blood pressure. We put up a video. We put up a diagram of the different types of the three different types of strokes. So be mindful of that. Can't stress that enough. We want to make sure you understand the signs and symptoms of a cardiac or of a heart attack and signs and symptoms of a stroke because everybody's out and about now. So you're going to see more of this compared to in the wintertime where everybody's in the house. Now everybody's out and about. So you want to make sure that you're aware of these signs and symptoms. Joe Vaz says sure will suck to a pinched nerve and have Bell's palsy episode. That is true too, because those are cases as well, and they mimic, especially Bell palsy, mimics that of a facial droop. And
I love that. I love that. I mean, that's a true sign of what we call differential diagnosis, because you're stacking up all these symptoms and these diagnoses, and some things can mimic others. And here's the thing about that is that when you're thinking about those things of what it could be, my mind always shifts to, okay, what's the worst of those things? And obviously it's going to be how it can impact someone's life. And I think that's something that you got to really pay attention to and prevent people from minimizing and marginalizing these symptoms, because you never know. You never know what could happen. If you see that something has changed or something is different, you can be able to jump on it and say, all right, well, let's just be sure. If this is something that is occurring over and over again, or it's something that is brand new and it's out of the blue. So don't, all right, let me take 2 of these and we'll see about it in the morning type thing. Get that checked out.
So for the chat, because I love participation, what's the one thing you've done or need to do to take better care of your heart? So if you think about it, we all have family, may not be immediate. Well, we all have immediate family, may not have children or something like that, may be growing and out. But what is something that you've done or need to do to take better care of your health? We were laughing earlier about being big back, and Carmen said, well, I'm about to jump on the treadmill now. So what are some things that you've done or you could do? Ooh, CG mama, that's what I'm talking about. Exercise. Joe, I'm gonna leave that one right there. I'm not touching that one. I'm definitely not touching that one. Okay, so dropping weight and gave up energy drinks and soda. Excellent job, Dr. Coy. You hit that last time as well. When it comes to the energy drinks, one of the biggest things with that caffeine and the sugar would definitely stress the body. So yes, that is one thing. Anybody else? What are some things that you've done to help get a healthier heart? Okay, Urban. Exercise. Love it. Love it. Love it. Yep. Anybody else? So another question for you. Keep it up. Okay. I love that. Seriously, trifecta: weight, diet, exercise. So, yep. So we do have that. And we'll want to say, think of all three therapies: physical, speech, and occupation, which is true. Okay. Take that as well. Now, what I want, okay. G23, I usually drink three of the, oh, wow. Ooh, you would drink some serious energy drinks. Yeah. That's crazy. Yeah. And I had to ease off because Dr. Cole was fussing at me about that. My pre-workouts, so I had to ease off on the
Whew.
pre-workouts. I know.
Lord have mercy.
I had to ease off on the pre-workouts. Carbon
Mm-hmm.
says remove stress and drama. That's one of the biggest things right there.
I
That
love
is
that.
so true. Remove stress and drama. All right. So when it comes to this now, so if you take a look, meditate is another one. So what's the one thing you've done? Oh, I'm sorry, wrong one. So one thing I want to know is when's the last time you had your blood pressure or cholesterol checked? What about that? When was the last time you had your blood pressure or cholesterol checked? There we go. Make sure I put that in there correctly this time. So when was the last time you had your blood pressure or cholesterol checked? That's one of the biggest things. Summer's upon us. Everybody, we talked about this in January. Everybody's in the gym. You go to the gym now, not as many people are in the gym now when it comes to that because and they faded off because we have that constant wave there. But when was the last time you had your numbers checked? Blood pressure, cholesterol, when it comes to A1C levels. When was the last time you actually had that check? And if you never had it checked, what's stopping you from getting it checked? So okay, every 3 months. Okay, G23. We talked about that earlier. So yes, every 3 months is definitely a good thing. Gee, mama, what's going on? Maybe a year ago. Come on now. But yeah, yearly physicals is good. If you have medical problems, you want to jump on a little more than that. But yeah, says here, Urban says BP have a machine, so check it often. Cholesterol twice a year when I get blood work. Excellent job. That's one of the biggest things. That's one of the biggest things is get that blood work taken care
Mm-hmm.
of. Get
I
it
love
taken
it.
care
Love it.
of. Don't take your health for granted. So yes, one that is so true. And a lot of people don't realize that they wait to the very last minute. They like, oh, I'm having a problem. Let me go get checked out now. Go get checked out now. So you don't want to wait to the last minute when it comes to that. Carbon, let me get mine. Okay, we'll talk about that later. But yeah, but yeah, you want to get it checked as often as possible. I won't say as often as possible, but you want to have a steady flow when getting that checked. So you want to be mindful of that. Dr. Whiteside, Dr. Coy, anything else when it comes to that? Because you face these patients, I hate to say it like that, but you face patients that come to you all at the last minute. So what do you tell your patients when it comes to that? Because like Wanda said, don't take your health for granted. But a lot of them do until they have that medical emergency or they have something happen. So what do you tell your patients when it comes to that?
Well, I mean, I think it's important for them to recognize. I'm glad that they're recognizing that something is going on, and there is time to do something. Of course, um, so I really appreciate and acknowledge the effort from that standpoint. But then taking it a step further is you have to do the proper testing. You have to do the testing that is going to look at, from my perspective, when people are asking, well, where did this come from, and or if they've been dealing with this for a long time, and they're just taking medication after medications, and it's not working. Um, they're getting side effects, and they're continuing to decline. it's most people will say that if they had the choice of not electing to not take the medication, they would elect to not take the medication. In fact, there's numerous studies that show that most people that are on medications don't really take them as they're prescribed. So so on one end, you're backing yourself into a corner with not taking a medication, and at the same time realizing that this is a serious issue. So I try to help relieve that pressure, that stress, to say, okay, well, let's get to the root of it. Let's address it. And so doing the proper testings that is going to really point to the reason why. And then from there, it's okay, there's going to be some things that need to change. Some people, exercise is not the right mode to go with at that time, because that is a stress. Sometimes you have to kind of take a step back and really start from the ground up and rebuild that to the where they can eventually get to exercise. I'm not against that. And this is, from a person that has a bachelor's and master's of exercise sports science, where I used to think that I can heal the world of obesity and with every treadmill and weights put in their hands. But everybody is different and everybody's at a certain place. We want to get them to the place where you can exercise. But a lot of times it's really starting from the ground up and rebuilding that person. So it's important to make sure that you get the testing that helps you to put these puzzle pieces together, form a plan, and then start working the plan. And maybe eventually, yes, exercise can be a part of that plan. But sometimes it's good to make sure that you understand what that person's risks are, and make sure that they're able to build up, and not start too hard, not too fast for some people.
So one question Carmen said is weightlifting okay to do for people with high blood pressure? So what are you talking about?
It can. Well, let me say this. Um, there are some types of exercise that can aid in your blood pressure. But there's some that the way you go about your exercise, you have to really watch it. So you don't want to find yourself lifting really heavy weights and doing what we call Valsalva maneuver, where we've all lifted a heavy weight and we had to kind of hold our breath and grunt and hold that what we call the interstitial pressure in your body to help stimulate strength. And when you're doing that, again, you're going to blow a top. So if you already have blood pressure issues, you don't want to find yourself lifting or maxing your weights on that. Whether it's going a little bit lighter, where you're getting some more movement, getting some circulation going, that can help. But again, you have to understand your relative risk. Sometimes that even that can be an issue. So you have to really get with a professional to see what your tendencies are, what issues that you have. Make sure that your labs are safe enough to allow you and clear you to be able to do what you need to do in the weight room or whatever mode of exercise you enjoy doing.
Cool. Dr. Whiteside, you good?
I agree with everything that Dr. Coy said. No change. I agree. The main thing is if people want to lift heavy weights, I don't see the point in lifting heavy weights. Uh, you can if you want to, but to be honest, you need more high rep, low weight. That's what you need. That's what I consider would be more beneficial to you. More the cardio. Cardio will help actually relax the vessels and lower your blood pressure and help decrease some of your risk factors.
I feel like y'all taking shots at me right now. I'm trying to put 4 plates on each side, and y'all like stop lifting heavy. Again, my knees are shot, so I know
You
I'm
don't like
pulling.
your shoulders? Go ahead.
It's all good.
Yeah, it's
Um,
always I think it's relative to what do you need that for. I think that's the key. Is if it's something that is something that you need to have or to be able to sustain, I mean, there's a method, a way to go about it. Hopefully you're doing it in a way that's not going to cause injury, which again, that's going to put stress and pressure on your heart as well. So those things that you just got to really work on, and it's dependent upon your relative goal. And of course, you just got to make sure that you do it in a smart manner.
Yeah. So here, how many people in your family are at risk for heart disease, and what are you doing to help protect them? Because again, I tell people we're the first responders for our family. So how many people are in your family, or how many people in your family are actually at risk for heart disease? And you think about it, you know how they're eating, you know, diet, exercise, and all that. So what are some things, if they're at heart disease, what are some things you're doing to help protect them from those heart disease? Because we talked about strokes, we talked about diabetes. Well, not today, we talk about diabetes. We talk about stroke and cardiovascular disease. So what are some things that you're doing to help protect your family? Are you talking to them about this? Are you sharing these YouTube lives out? Because, hey, this is information for them. So what are you doing to help protect your family from heart disease, strokes, or anything of that nature? And just drop it in the chat. And while y'all are doing that, Urban asks, how do I raise my good cholesterol? So what are some ways to raise good cholesterol?
Exercise. Exercise is going to be the main thing. That'll help increase your good cholesterol. People say red wine, but as I've been doing more studies, there's nothing really proven that red wine will actually help increase your HDL, which is your good cholesterol. And genetics has a big part that deals a lot with it as well.
Dr. Corey?
Yeah, I mean, as far as your good cholesterol, I think for me, I'm always looking at signs and drivers of inflammation. Your cholesterol, you need cholesterol to help with delivering resources throughout the body. The cells need that. The cell membranes need cholesterol. You need cholesterol for hormone production. You need those things is needed. But to raise your good cholesterol is again trying to make sure that you're decreasing burden of inflammation. One thing that is interesting though, your HDL can actually be too high as well. There's a sweet spot with your HDL, and that's deemed a good cholesterol. When we see high numbers, when it's above 80, that's actually a sign of inflammation, and that's also a sign of infection. So we don't want that to be extremely high either. So there's a sweet spot with the cholesterol there that you have to really pay close attention to. But again, making sure that inflammatory processes are at a minimum.
So another question. Thank you all, chat, for that. Another question for you. This one I'm trying to drive home what we've been talking about here. So there you go. What scares you the most? Not recognizing the signs or not knowing how to respond in time. So we talk about the signs and symptoms of both stroke and heart attack. So what scares you the most? Would it be not recognizing it, where I should have noticed that earlier, or is that you don't know what to do when that time comes? So which one scares you the most? Not recognizing the signs or not knowing how to respond in time for that emergency? So for me, prior to becoming a paramedic, me was not recognizing the signs. So that was one thing for me. Didn't recognize the signs at all. Family members having high blood pressure, not knowing it, got a constant headache, visual disturbances, stumbling around, not knowing that because we have a family history of high blood pressure. So after going through this, being medically trained, I now can identify and recognize the signs and symptoms. So I love that aspect of it, but it still scares me that family members do not recognize this, and I can't stress it enough. So so that's one of the things. So now I'm able to recognize. Now I can respond in a timely manner. But both of them for me initially, prior to, was not recognizing and not knowing how to respond. So Carbon says how to respond, which is totally understandable. If you're not faced in that situation, or you think about being a prepper, when we prep, we prepare for things. Medical is something totally different because you never know when. So how to respond. So you just have to constantly run those scenarios and just get the training. That's one of the biggest things. Lead us to a segue. We do offer CPR. So if you're looking for CPR training, visit us at www.whitesidetacticalsolutions.com. Yeah. Okay. So how to respond is one thing. not recognizing the signs. So that's one of the biggest things, because you could be talking to the person and then they could literally have a TIA right then. You missed it, then they're talking normal again. So, or they're stumbling because they may have had a TIA, but you didn't recognize. You thought they just tripped over something. So, not recognizing the signs. That is so true. Okay, happen. So here, G Mom will talk about time. Yes, it could happen. It could be happening, but not aware that what exactly is happening. So that's going to be one of the biggest things, not actually recognizing when it is happening. Thank you. I love how y'all respond. Yay. How to respond is another one. That is definitely it. How to respond. And Carmen say, if you know how to respond, you should know the signs. Honestly, I'm not going to lie to you. It in the way that it all depends on the person, if that makes sense. If you know how to respond, you should know the signs. You should, but at the same time, if you see the signs, you should know how to respond. Not always, even in the medical profession. For me, I have a partner and we had a GSW, a massive GSW, and she froze up. So it's like, yo, come on, you're the lead. I'm taking the command. So for her to freeze up like that, because it was just a massive GSW. So again, you may know the signs, but you may just freeze up at the time. So you have to be careful of that. Dr. Coy, did you want to say anything about that?
No, I think you hit the net on the head on that. Don't need to add anything to that.
Jova, Carmen, there are a lot of emergencies that present this. That is so true. That's one of the biggest things I can't stress that enough. There is so much when it comes at a lot of these will mimic others, and that's why I said earlier. Where are they diabetic? Are they having a stroke? Are they drunk? We don't know. So there's more testing that has to be that has to occur for that. But just to know the signs and symptoms. I'd rather than be drunk and you call 911 because you weren't sure than they're actually having a stroke and you don't call 911, or a diabetic emergency and you don't call 911. So that's gonna be the biggest things when it comes to that. So out of all things, call 911. All things, just call 911. That's one of the biggest things. Want to say, I try to set the example for my family. That's one of the biggest things for us, even as medical professionals. We try to set the example. We want to set the example. Sometimes we fall short of that, and that's just a human thing. But yes, that is so true when it comes to that. Dr. Whiteside, did you want to add anything when it comes to that? Any questions or anything you want to add? You're on mute. Oh, you sure? Okay. So last thing when it comes to this, I'm gonna drop this in the chat as well. Make sure I drop it in the chat. Okay. Because we talked about heart attack. If somebody has a heart attack or if somebody goes into cardiac arrest. So we know a heart attack and cardiac arrest are two different things. So we truly understand that. But what happens if they go into cardiac arrest? Would you feel confident performing hands-only CPR in an emergency? Why or why not? And if you have no idea what hands-on CPR is, put that in the chat. Say, I have no idea what it is. So would you feel comfortable or confident performing hands-only CPR in an emergency? Dr. Coy, you talked about that earlier where y'all had that game plan. The guy went to cardiac arrest. Boom. Yeah. Y'all had y'all playing together. You would take care of everything. So I love that. I love that. So what about you all in the chat when it comes to that? Would you feel confident performing hands-on CPR in an emergency? And with that said, are any of you all CPR certified or is CPR trained? Have y'all received any type of CPR training? So want to know about that as well. Hey, Shani, how are you? Welcome. So, Dr. Whiteside, since people are putting stuff in, can you just give us your experience if you ever faced a cardiac arrest and you had to actually do CPR, or work in a hospital setting, you ran multiple codes? Can you just give people some examples of those, of what's happening and occurring?
What do you mean as in what am I doing? What am I thinking when I'm going through it?
Yeah, just your experience.
Okay, usually I would hear an overhead page, the rapid response code, something like that. I'll show up. As a physician, I'm standing at the foot of the bed. When I stand at the foot of the bed, it gives me a view of everything that's going on. It is literally organized chaos because you have people doing compressions, you have people pulling out medications, you have people putting them on the monitor, you have somebody at the head of the bed putting a tube in the throat to help them breathe. So a lot is going on at one time. uh, what we see when we do CPR, it is not that. Sorry, I realize my stuff is all sideways. When we're doing CPR, it is not that pretty Hollywood CPR. It is really an upper body workout. It is labor intensive because your job is to actually now become the heartbeat for the body. So every compression you're doing, that is you now being the heart and beating for the patient. Trying to think of what else goes on. You have just a lot of people doing a lot of talking, crosstalk, but mainly a lot of people are listening to the physician to find out what we need to do next. Pouring out a bunch of different medications, and I can name them all, but there's literally a lot of different medications. So some of the stuff you see on TV is a little bit real, but you will not understand how much of torture the person that you're doing the compressions on, how much torture the body goes through, because you're actually pushing through the chest and breaking bones to actually get the heart to start beating again.
Dr. Corey, did you want to add anything about that one?
No, I think I was good there.
Okay. So one thing I want to pull this up real quick. Let me see if I can share this. Oh, there we go. Healthcare worker here. I had to literally hop on the bed as a rolling. I've done that before. It is so cool when you're doing it, feel like you're on TV doing chest compressions while they rolling. Granted, I'm 230 pounds, so they got sort of mad at me because I'm heavy. But somebody like you just jumping in there and just pushing. So again, it's pretty cool when you do stuff like that. You feel like you're on TV, but at the same time, it's something that you actually have to do. Something that you have to do. Would you say on the smaller version? Yeah, there you go. Sometimes you're thrown into the fire as well. Yep, that's so true. That's so true. One thing I want to share with you is, again, we don't get paid for this, but the American Heart website, that's one of the biggest things. So if you're ever looking for CPR training, anything of this nature, you go to American Heart. This is what it is. You just type in American Heart Association, or at the very top over here, heart.org. You go there and then you click on here, learn CPR, something of that nature. You can find classes in the local area. Again, I can't stress enough. Just get the experience. You don't have to become certified, like how Carbon says, CPR BLS certified, which thank you so much. We need that. But at the same time, even if it's not just taking a certification course, just becoming familiar with how to do CPR, because you never know when. Like Dr. Corey was saying earlier, granted, they're trained for it, but you're in the gym working out, somebody passed out, going to cardiac arrest, now you're doing CPR. You may be on a treadmill beside that person, they pass out, you're the first one there on scene. So just having that there, just having that general knowledge, not saying doing mouth to mouth, that's totally different story, but just having that general knowledge of how to do CPR. Go to American Heart, you got American Red Cross as well. Go to one of those just to get the training. I can't stress that enough. They offer free courses as well, not certification courses, but they offer free courses, or what we call hands-only certification. So do that as well. Carbon picking on me now. If I ever see Whiteside get on the bed, I'm not pushing it. They'll probably flip me over with it too, or it won't move at all. But yeah, but you got that adrenaline pumping, so you ain't never know. You may be able to. So, all right. So with that said, it is currently an hour and 33 minutes. Don't want to hold you all up much longer when it comes to that part. I truly want to thank you all for your participation. That's what made it worthwhile, because we want that crowd participation. Get in there, ask these questions, and just thought-provoking questions to see, have you really thought about that? Today we've covered strokes. So your signs and symptoms of strokes. We talked about cardiac arrest, signs and symptoms of a heart attack, and that a cardiac arrest, differentiating between heart attack and cardiac arrest, talking about diabetic emergencies as well, slight touch on that, as well as just understanding CPR. So we hit all that, as well as high blood pressure. So we hit all of that. So I truly want to thank you all for that. With that said, Dr. Coy, Dr. Whiteside, anybody, any last words?
I don't have any. Sorry, y'all. I was called last night to be on call for today. So sorry for my tardiness.
No problem, man. Yeah, I'm Dr. Corey Ibrahim, co-owner of Core Wellness Solutions, functional medicine practitioner, helping patients get to the root cause of chronic disease, like type 2 diabetes, hypothyroidism, autoimmune diseases like Hashimoto's, thyroiditis, and other autoimmune diseases. We also help companies as well. So If you're involved in a company that if you're an owner or a entrepreneur that is looking to help your employees to get healthier and to help, get them more active or to lower insurance premiums and just overall helping your productivity. We have programs for that as well. And again, this is really a great topic that is instrumental in helping save people's lives. And so we do give individual consultations to help individuals get to the root cause of it. If you're not, you're tired of medications, you're tired of the same treatment plan, but it's just medication after medication, complication, side effect after side effect. You're ready to get to the root cause of it. We'll be more than happy to consult with you to help with those issues. And of course, it's Men's Health Month. All the men in your life, the best thing is Father's Day coming up soon. One of the best things that you can do is that special male, check on them. Make sure that you're asking some of these key questions that sometimes we're not getting those questions asked of, oh, when is the last time you've been to the doctor, or when is the last time you had a checkup? And I think the biggest gift that you can give, not a tie, not going out to eat, not a massage, but hey, let's get them to a doctor. Let's see what's going on, your relative risk. And of course, we're here to help with that as well. So happy Father's Day to all those fathers out there, father figures, and all those folks out there. So we appreciate you, and we appreciate all of you guys here that's performing this podcast and getting this information out. It goes on, it's very appreciated. So I appreciate you guys.
Yep. Make sure I check out his Instagram. Carbon Q just dropped his Instagram. Make sure you check out his Instagram. Also, on his Instagram has a link to his website. Hit up the website as well. So again, let's do that. Let's support him. Again, like you support us, let's support him as well. Give him those followers. Share this live. Go him. He always giving webinars as well. Share those webinars as well. Join those. Share those. Because again, we're giving you the information. We can't force you to do anything with it, but we're giving it to you. So at least share with your family members or something of that nature will be greatly appreciated. For us, Whiteside Tax Solution Med Inc., we have our website, whiteside-taxsolution.com. We also have our Instagram. Follow us if you want to follow us. We give information out there as well. We do a lot of CPR training. We should be heading down to Florida soon. Not close to your area, but Fort Lauderdale, which is not real close to you, but going down there as well, doing CPR training as well, because we want to get with another CPR instructor. So biggest thing is we've covered a lot of information today. We do want to thank you all for that. But like, comment, share, subscribe, follow Dr. Coy's Instagram. Other than that, you all have, one question. I missed something. So we did say, remember June is Men's Mental Health Awareness and PTS Awareness as well. So Dr. Coy, when was the last time you went to the doctor? Ooh.
Oh man.
Now.
Hey, doctor, heal thyself. I actually have to get my own blood work done. So I have to do my own little re-checkup. So I'll be doing that this month.
Oh, there you go. Mm-hmm. Hey, y'all gonna ask me. I go every summer. But look, my insurance paid for. I'm sitting there. They say, hey, go ahead and get on that machine. I strip everything off. Take me as I am. I ain't hiding nothing. I'm not shy either, but still, like, hey, put me up to EKG, draw my blood, do whatever you need to do. So that's just me. Dr. Whiteside, when's the last time you visit a doctor? Yeah, exactly.
Just now, I looked in the mirror.
See, that's what we're trying to get rid of, man. Golly, man.
Let me see. Last week, where I work, I see my doctor on a regular basis. So if there's an issue, I go and see him. I'm not shy about it. My health care, I'm like, hey, I'm paying for this. Hey, listen, I farted wrong. I need to see you for this. I'm paying for everything.
Hey, wow. Irvin said that jug is huge. That's what she said.
It's a gallon, man. It's out here in Vegas. Let me see. What are we right now? It's still 104 degrees at 6:30.
Yeah, y'all can have that. Anyway, all right. So it's going on an hour 30, hour 39 minutes. Don't want to hold y'all up anymore. Again, follow Dr. Coy. That's one of the biggest things. Carbon Q dropped his information. There we go. Carbon Q dropped his information right there. Instagram.com/Dr. Coy. Also, what is your wellness one? Your wellness Instagram. Is that the one, Dr. Coy?
It's the same. Yeah, it's
Okay.
Core Wellness Solutions. So it's all the socials. Koi Wellness Solutions. That's KOI, like the fish. Wellness Solutions. It's Facebook, Instagram, and yeah, that's us.
All right. Perfect. Y'all have a good evening. Thank you for joining us, and we see you all next time.